When I began in practice, I had a traditional family practice, and I had a very straight hallway where people would come in and they got their blood pressure done. And if their blood pressure was a certain number, then normal, let's say, we did nothing. If it was a little bit high, there was actually a little arrow chart where it said, if it's this number, give that drug. And you'd give that drug. And over the years, 20 or 30 years, all of that has changed so that there's different medicines now, and the blood pressure is the same and the problems are the same. So why are the drugs changing, and why is that happening? Because they don't necessarily perform better. It seems to be more about just the flow of information in the conventional medical system has to do with the finances and the politics and insurance. And in natural medicine, it's not so much that way. And I want to give you a list of natural things that you can do to improve vasodilation. L-arginine, it's a naturally occurring amino acid. It dilates blood vessels. It has lots of beneficial effects. It's very inexpensive, 500 milligrams, 2 capsules 2 or 3 times a day will drop your blood pressure somewhat. Magnesium, the most common deficiency in the North American culture is magnesium deficiency. It causes vasoconstriction. It causes you not to be able to sleep at night. It causes all sorts of stress-related phenomenon, and replacing it will drop your blood pressure somewhat. There's nothing like getting it checked, though, to prove that it works. So L-arginine or magnesium, niacin. Niacin's a vasodilator. You can tell because it makes you flush. Sustained release niacin makes you flush less, and it is a more sustained vasodilation. So L-arginine, magnesium, niacin, they're all good. White flesh fish. And we're not really sure why this is, but white-fleshed fish, the protein that's in there tends to create a reduction in blood pressure based on the amino acid profile. We're not really sure why. It may have to do with L-arginine or other things, but we do know that it can work. All of these things are not diagnosis and treatment. We know that blood pressure tends to get high in response to stress or deficiencies in metabolic problems. Let's fix that and see if it fixes the blood pressure. I don't want to treat hypertension. I want to support your physiology. So I don't want to make your disease go away. I want to make your body better. And ultimately, and I know this may sound kind of like a reach, but testosterone creates vasodilation. Estrogen causes vasodilation. Natural hormones at their optimal levels improve the blood vessels in the circulation. Ask any woman who's applied estrogen to her face when her skin doesn't look good. When they do that, their skin improves because blood supply improves and the skin repairs itself. So we know there are a whole broad spectrum of natural health things that we can do to improve blood pressure. Losing weight, it's the holy grail. If you can lose weight, you'll drop your blood pressure. From the time that someone loses 10 to 20% of the body weight, they'll generally go from mildly hypertensive to normotensive or normal blood pressure and don't require drugs. If you need medication, use one that's been around for a while, and just make sure with your doctor that it's well proven, it's been around for years. And if you work with your doctor closely, blood pressure is easy to manage and it will extend your life 10, 20 years. Really worth doing. Get with your doctor. We're better together.